Thank you, Madam Chair. My question is for Dr. Wales, and then I would like Senator MAiD to respond as well. So we know that Bill C-7 requires medical practitioners to inform patients of reasonable and available means to relieve their suffering. And this includes pain management, palliative care, and in some cases, surgery. Given your expertise in the field and your knowledge of MAiD, do you believe that Indigenous people living in remote areas who have limited access to pain relief treatments and surgical care could have their right to MAiD denied or delayed because of a lack of access to these healthcare options?
Shall I go first? I mean, I think we can all agree that the lack of medical services in general in any underserved area, in any Indigenous community is a national shame, and it's something that extra legislative measures should be taken to ameliorate. Whether someone, and I would probably say also that in settings where good palliative care is not available, it's possible that MAiD services are also not available. And I think the most important thing we can do is advocate for medical care in general to be available, and that includes care that social services that affirm a patient's dignity and autonomy, as well as palliative care and MAiD services. I think we can all agree that that should be advocated for. And was the question whether MAiD could be provided in settings in which, for example, palliative care is not available?
Yes, if they have limited access to pain treatments and surgical care, and would their right to MAiD be denied or delayed because of these lack of access to healthcare options?
Yeah. Fortunately, it's outside of my experience, and I can't comment besides sort of a hypothetical, but I would suspect that a diligent MAiD provider would ensure that all treatments that are desired by a patient be made available. But I can't speak to that particular situation.
Okay, thank you, Dr. Wales. Dr. MAiD?
Oui,
Well, based on my experience in Quebec, I don't think that people have turned to MAiD because there was a lack of access to palliative care. I'm talking about my experience and from certain reports that I've received as well. Now, all the reports and even the letter from our minister, all individuals who have requested MAiD were receiving palliative care already. What people ordinarily think is that because you make a request for MAiD, it's because you didn't get palliative care. No, people have received palliative care before they asked for MAiD. So that's based on my experience. The answer is no. Now, on the provincial level, they can get organized. I mean, because it's under provincial jurisdiction, they can get organized for that. Then, if we look at the other departments for medical care, it's not just in palliative care that there's a lack of accessibility. In all sectors of health services, we're seeing that there's these types of shortcomings. So I've got some doubts personally that that would be a reason that would require people to turn towards MAiD.
Bill C-7 requires medical practitioners to inform patients of reasonable and available means to relieve their suffering. And this includes pain management, palliative care, and sometimes surgery. Do you believe that Indigenous people that have limited access to pain relief treatments and surgical care could have their right to MAiD denied or delayed because of the lack of access to these healthcare options?
There's no question that Indigenous people do not have the same access to palliative care, particularly in remote settings, the same access to pain relief and to possible surgical options. So I do believe it could either compound the desire to pursue MAiD because their suffering has not been alleviated through well-known evidence-based approaches, or alternatively, as you've suggested, that it could be delayed for the same reason.
Thank you, Dr. Richardson. I have another quick question. My next question is about the removal of the reasonably foreseeable death clause. There's a crisis in Canada across Indigenous communities. We know this. Many Indigenous people commit suicide or contemplate suicide because of the ongoing challenges related to socioeconomic inequalities, intergenerational trauma, and the previously mentioned lack of culturally appropriate mental health services. Because Bill C-7 repeals the reasonably foreseeable death clause, do you believe that there's a risk that the same factors that lead to an increased suicide rate among Indigenous populations may also contribute to once it becomes widely accessible? And what additional safeguards could we put in place for vulnerable populations?
There is no question that that is a concern of mine and of many of my Indigenous colleagues and Indigenous physicians and other healthcare practitioners. This is why we are concerned about going forward with the bill as stands without first addressing the major social inequities that exist that contribute to both the high burden of chronic disease amongst our people, the higher burden of mental illness that's related to intergenerational trauma, without access to appropriate healthcare. We know there is that significant gap that is ongoing. As we're talking about discrimination on this call, I'm just amazed that we don't actually accept that we have a second tier of healthcare for Indigenous peoples in Canada based on all of the evidence. So I'm deeply concerned about that in the bill as it stands. If there were some permission to say that there would be addressing and a way to address social determinants of health for a particular individual who's experiencing intolerable suffering before any other action was placed, removing them from conditions of poverty, access and referrals to appropriate medical services, food security. If we address all of those issues and a person is still experiencing intolerable suffering, then perhaps this could be an option.
Thank you, Dr. Richardson.